Sleep apnea. You know, recently the Los Angeles coroner released its findings on the death of actress Carrie Fisher. She died in December at the age of 60. The agency said that her manner of death is undetermined, but medical examiners concluded that sleep apnea and other undetermined factors did contribute to her death. Joining me this morning to discuss how sleep apnea in particular could be a factor is Dr. Scott Ackerman with Ackerman Cancer Center. Now, we know that Carrie Fisher also had drugs in her system, so we you know, obviously full disclosure. But I think it was interesting when the initial report came out, we're looking at this and we're like, sleep apnea can kill you? Really? What, first of all, for our viewers not familiar with it, what is sleep apnea?
So sleep apnea affects a lot of Americans, more than we realize. It's about 19 million Americans are affected by sleep apnea. And what it is that when you're sleeping, you stop breathing. And some people that have sleep apnea, they can stop breathing many times per minute, many times per hour, and they can have these long intervals where they're not breathing and they don't realize it. That interval of not breathing causes hypoxia, which is a reduced oxygenation state, a reduced oxygen in your blood system, and that reduced oxygen can lead to other medical problems.
Well, it's interesting, though, because, I mean, if this is happening, obviously, when you're sleeping and you are single, how do you know that you suffer from sleep apnea? I mean, are there warning signs? Yeah,
well, it's hard to know. You don't know it if you're single. If you're married or someone in bed with you, they may hear you stop breathing or hear you snoring excessively. But the warning signs of sleep apnea are loud snoring. And again, if you're alone, you wouldn't necessarily know that. But if you wake up in the morning with a dry throat or a sore throat, that's a sign that your mouth's been open all night and you've been snoring. If you wake up in the middle of the night with this gasping or choking sensation, that's because you've been awakened because you don't have oxygen and you feel like you can't breathe. But many people don't even know that, and so sometimes the only sign of it is that maybe during the day you're a little bit sleepy during the day, like you didn't get a good night's sleep, or you have irritability during the day. Again, these are things associated with not getting a good night's sleep, or mood swings. Those things, when you have those things, think about what really is going on. Why am I not getting a good night's sleep? Why am I having this irritability and mood swings during the day?
So, and it's interesting, too, because I have some heart issues with members of my family, and when we have gone to the cardiologist, they'll say, hey, do you have sleep apnea? So it turns out that as a result of this stopping breathing, then you can have pretty serious health consequences, and can it be fatal?
Oh, absolutely. What happens is, when you have sleep apnea and you're not breathing, your heart is overcompensating, or it's compensating more to get blood around your body. You don't know it. You're just lying there. But since you're not getting oxygenation, your heart's trying to beat harder, trying to beat faster, and so it will lead to hypertension. It'll lead to cardiac arrhythmias. This hypertension then leads to coronary artery disease, puts you at higher risk for stroke. This extra pressure, the heart trying to compensate, can lead to heart failure and also to heart arrhythmia. So some people see their doctor and they have atrial fibrillation, and that could be related to sleep apnea. And also diabetes and obesity are related to sleep apnea, but it's which came first, the chicken or the egg, because people that are diabetic have a higher incidence of sleep apnea and vice versa, and also obesity, same way.
So I know there's sleep clinics, right, that you can go to then and get tested then to see if you have sleep apnea. Is that the best way, really, to talk to your doctor if you think that you might be a candidate for it?
Right, you should talk to your doctor about it, but a lot of primary care physicians haven't been that aware of sleep apnea. They are more and more, and what should be done, you should be referred to a sleep specialist, and there they have sleep clinics or sleep test, where you're in a room and you go to sleep for the night. You spend all night there, and they have wires on you, and they can see.
Doesn't sound real appealing, but it's important. What are your treatment options?
So treatment options. There's two types of sleep apnea. One is essential sleep apnea, where the brain is not allowing you to sleep, and that's related to alcohol consumption or drugs or those sort of things. So cutting down on excessive alcohol and that sort of thing will help that. But more commonly, it's an obstructive sleep apnea, where the back of your throat is obstructing the airway. And that can be remedied by a few ways. One, it's related with obesity, so if you lose weight, that'll help that. But also there's three other ways. And one is an orthodontic appliance that keeps your mouth open. Number two, a continuous positive air pressure machine, a CPAP machine that keeps that open. And number three, you can have surgery there where some of the uvula, the thing that hangs down when you yodel in the back of your throat, and your soft palate, your tonsils are removed, so that airway is kept more open.
To keep it, so that you can breathe a little easier. Doc, thank you very much.
Thank you.
Do appreciate it. If you know